Hey Andrew, what's a scar tissue and how is it different from normal tissue?
You can picture where scar tissue is your natural body response to do a patch-up work. So what it's doing is it's trying to restrict some of whatever the injury may be happening in there and kind of put like a seal over the injury tissue. But over time, that seal becomes less elastic, like it doesn't have elastic, it gets restrictive. It's not like your live skin tissue where you can pull your skin, there's more elasticity there. Scar tissue is kind of like a restrictive tissue. So it's there just to do a patch up, so it doesn't have elasticity in there. So over time, then that tissue gets more restrictive, lack of the fluid in the area, then you're gonna notice more range of motion decrease because you can't really reach to a certain weight because they're stuck in that sense.
Can scar tissue cause pain even years after the injury or surgery?
Well, it can. If scar tissue is not repaired properly and your body responses, then it can cause pain. Actually, you can cause more pain and discomfort even after an injury where your body is healing and it's having difficulty from healing. And then the scar tissue remains causing more discomfort and pain.
Can it pull on other parts of the body even if it's far from the scar?
Technically, it can, because if there is a scar tissue, for example, on your thigh muscles over here, and your muscle in order for you to move the leg up into a extension, the muscle needs to contract this way in order for that to happen. So if the scar tissue is there, even though it's away from the joint, this muscle is preventing the muscle to contract properly because it can't pull on it. So what you'll notice is if you're able to bend this neutrally, like normally with no injury, after the injured tissue, if the scar is still there, you might have restrictions of that motion. And so instead of flexing all the way, you might be down here, you might be like 10 or 15% of decrease of the range of motion, depending on where the location of the scar is and how deep the scar is and the type of the tissue it is.
What are signs that a scar might be affecting movement or posture?
Of course, if the scar is there, for example, on your lower back, then doing some twisting and turning motion or flexing down, the scar tissue will be pulling on you specifically, preventing you from doing the full range of the motion.
Should people be massaging or stretching their own scars at home?
Yes, massage would be definitely something you can do. So for example, like if the scar tissue is here, you can take, you can use your fingers to rub on it. However, generally speaking, using your fingers isn't as enough of that pressure. So normally what we recommend is use your knuckles to actually go into the tissue and friction up and down, side-to-side motion to break down the scar tissue specifically.
How do you know if your pain is being caused by scar tissue?
There are a few things that scar tissue can be developed over time from an actual injury, but you won't truly know till you actually go into the joint or open towards the tissue and open up to see if there is a scar tissue or not. Secondary factor, you can do an ultrasound diagnostic tool to scan the area to look at if there is a scar tissue. But in general perspective, if there is a scar, like an opening of the joint or to the muscle tissue, you ruptured it, you banged on it pretty hard, you had a surgery, open joint surgery, or whether it's for knee, ankles, or hip, or joint, or anything like that, you might have a fracture from before. All those are direct impact to the muscle tissue, which will cause scar tissue at the end of the day.
If you have a scar tissue that is hurting you, what would be the remedy for those kinds of situations?
When we say hurting you, that will depending on the situation of, is it hurting you in a way where restricting your joint motion? Because if it's restricting your joint motion, you're feeling pain, then it's actually just because of the scar tissue restricting the motion causing pain, not specifically because of the scar tissue actually giving you pain per se. So for example, like you can have a scar at the back, but you're feeling pain from here in the front. So that isn't because of something is wrong in the front, but because the scar tissue in the back, like restricting the motion of your joint, therefore making you feel the pain in the front. So just because you have pain in an area away from the scar does not mean that it's because of something wrong in that joint specifically. It could be because of the scar tissue restricting you. Vice versa, if you have pain specifically because of the scar, that means the tissue is still there, preventing the motion of your muscle, the fascia, which is the connective tissue, and then also restricting the blood flow because the nerve goes in, like the nerve innervates in it, like it grows a cross pattern towards it. So it passes through, therefore you're feeling the pain because the scar tissue is compressing the nerve, making you feel that every single time you do a motion.